A lot of times patients will tell me, oh, I haven't seen an optometrist because I can see clearly. I have 20/20 vision. But what we want patients to know is that there are so many things that your optometrist can check for beyond just the ability to see clearly.
Welcome to Visionary Voices in Optometry. We're excited to have you here today. We have a very important conversation about eye care in the province of Ontario. I'm Mark Donnison, the CEO of the Ontario Association of Optometrists. And with me is Dr. Shaina Nensi. She's an optometrist and the president of the OAO. Thank you for joining me today, Shaina, and it's nice to see you.
Thank you so much for having me, Mark, and I'm excited to be here today. Thank you.
So let's jump into our conversation.
Let's do it.
Tell us a little bit about yourself, and specifically, how and why did you pursue the career of optometry?
Great question. So as you mentioned, I'm an optometrist. I practice in Toronto. And, I didn't grow up always wanting to be an optometrist. I knew I loved the sciences. I knew I loved people. And I always wanted to choose a profession where I got to meet a bunch of people and wasn't necessarily like a desk type job. And I did a bunch of job shadowing actually in undergrad. I job shadowed a family doctor, I job shadowed a veterinarian and a dentist, and I job shadowed an optometrist as well. And optometry just had so much of what I was looking for. Like I mentioned, I wanted to have a profession where I got to meet a bunch of people. And I got to work with a lot of healthy populations, but we also get to do so much preventative healthcare as well. And what really solidified it for me was actually a mission trip I went on with an organization called Unite for Sight, where we went to Ghana and went out in really rural communities and provided eye care to the populations out there. And a lot of times we would bring them back to the capital city of Accra to get cataract surgery, and just being able to see the difference in their vision before and after that surgery and how much it impacted their life. You'd see farmers who weren't able to provide for their families anymore, and then they got this sight restoring surgery, and it was like their whole life changed. And it was really sort of motivating and a feel good story. And now I get to do that every day. Not so much with, farmers in Ghana, but I get to see young kids who aren't able to see the board at school, and all of a sudden they put on their first pair of glasses and they're able to see again. Or senior populations who are struggling to see and to play with their grandkids and look at pictures of them on their, no one uses real pictures anymore, but on their phones, and then have a sight restoring surgery. And I get to be part of that, and it feels really good.
So that's wonderful. And so on top of caring for people, you're also the president of the Association for Optometry in the province. So tell us a little bit about what the association is all about and what it does.
Great. So the Ontario Association of Optometrists represents over 2,000 optometrists in Ontario. And our goal is to support these optometrists to help them provide, the best quality eye care that they can. We have a big advocacy role as well, both for our optometrists, but to the government, and to try and make sure that eye care remains sustainable in the province. And then another thing that we do is make sure that the public and the general public understands what optometry is all about and the importance of eye care. And so it's been really rewarding to be the president of that association, and it's a really exciting time in optometry to be a part of the organization.
So what would you say are the top 2 or 3 priorities that the association has now?
Good question. So definitely the big one for us is sustainability. I think that is a common theme in a lot of things today. But for us, it means sustainable eye care delivery. So part of that is advocating for better remuneration for our services from the government so that our members can continue to provide the top tier eye care that Ontarians deserve. And so that is a big, important piece for us. The other aspect of sustainability is scope and making sure that Ontarians have access to procedures and, eye care that they need. So for example, optometrists are educated and, equipped to be able to prescribe all sorts of topical and oral medications. But the way legislation is currently written, we are limited to what we can prescribe to our patients. And so that can sort of hinder the quality of care we're able to provide. And so it's the association's role to really advocate for optometrists being able to practice to that full scope so that we can better serve our members. And so those are two things that are big on our list of priorities for this year.
So patient care for optometrists is obviously very top of mind. Patient care has also been in the news a lot lately in the province. And could you share with us why it's so important that people go see an optometrist to get their eyes checked?
It's so important because your vision is such an important sense. And your optometrist will be able to tell you if there are aspects of your vision that need to be addressed, sometimes that you might not even notice yourself. A lot of times patients will tell me, oh, I haven't seen an optometrist because I can see clearly. I have 20/20 vision. And so I didn't necessarily think that I had to come get my eyes checked. But what we want patients to know is that there are so many things that your optometrist can check for beyond just the ability to see clearly. Things that can impact your overall systemic health, like diabetes, hypertension, things that we can see inside the eye that you might not be able to see or might not be at the point of affecting your vision yet. But it really can be a good preventative tool to get your eyes checked on a regular basis to make sure that you are systemically healthy and not just able to see clearly.
November is Diabetes Awareness Month. Why is it important for somebody with diabetes to go see an optometrist?
It's particularly important for diabetic patients to have their eyes checked because there are a number of ways that diabetes can impact your eyes, both to your vision and to your eye health. You can get something called diabetic retinopathy, which is changes to the retina in your eyes. And if you are able to catch those changes early, even before they start to affect your vision, then we can prevent the chances of there being vision loss. And so it's very important to have your eyes checked on a regular basis. It's part of the reason why OHIP covers eye exams for patients who have diabetes. And we recommend that you do get your eyes checked on an annual basis, at least with your optometrist.
So that's obviously a very strong and powerful feeling for you to have, looking after people and helping them with their vision, maintaining their eyesight, and really finding things that are potentially issues that they need to look after, right? Mm-hmm. So on a similar vein, when you think about the future, what has you feeling excited about optometry in the province?
One of the things that really excites me is the addition of AI into our optometric care. So, back in the day when you went to an optometrist, it was probably a very different experience. For example, we used to use projectors for our eye charts or actual paper charts, and now we have electronic charts. And that's just a little example of how technology has changed our practice. But now when I go to conferences and see the types of technologies and the impact that artificial intelligence has or is going to have on our profession, it's exciting to me. I know sometimes people get afraid of AI and that it's going to steal our jobs or whatnot, but what's really happened in the optometry space is we've been able to detect certain eye diseases much earlier using AI because, a AI program can look at thousands and thousands of images of the eye and help detect subtle changes that myself as a practitioner wouldn't necessarily be able to see right away. So in addition to, making our jobs easier, it can detect eye diseases or help optometrists detect eye diseases earlier, in turn, preventing vision loss, which is, of course, top of mind for all optometrists and for our patients too. So AI in the optometry space is something that's really interesting and exciting to me right now.
What would you like for our listeners to take away today from our talk? So what's the most important thing that you'd like to leave people with?
I would just like people to know the importance of routine eye care. Your optometrist really is your primary eye care professional. And as I mentioned previously, there are so many things that a routine eye exam can help detect. And so it's so important for you to get your eyes checked regularly and to include your optometrist in part of your healthcare team.
Thank you so much, Dr. Nensi, for joining me and everybody today. That was fun, really interesting. Thank you so much. That was terrific.
Thank you for having me. Look forward to being back in the future.
So thank you for joining us today. That was a lot of fun, and hopefully you found that very interesting. We look forward to welcome you back again for another important discussion about the value and the importance of eye care in the province of Ontario.